It's the 7-Minute Drill, a fast-paced and fun conversation about common orthopedic topics and solutions with Dr. John Urse. Brought to you by
Ted's Authentic Greek Salad Dressing and Marinade. It's healthy, gluten-free, and delicious. That's Ted's Authentic Greek Dressing and Marinade. Thanks, Ted.
We would also like to thank
Stifel's GWR Group combines more than 65 years of experience helping high-net-worth clients consolidate, coordinate, and simplify their wealth planning strategies. The group has access to a full suite of resources to serve all of your financial needs. Email gwrgroup@stifel.com or call 937-353-2863 to speak to Guy, Brad, or Jeff Richardson. Stifel, Nicholas & Company, Incorporated.
Dr. Urse, you know this is going to be a great podcast when we have a 911 sitting right in front of us.
That's right, Terry.
You know why it's great? Because look at that. Look at the lines of that car. Would you? That is the classic sports car of all time. But that's not why we're here. We're here to talk about
safe driving and travel after surgery.
Oh boy, this is when
it's kind of a boring topic.
This is where we get lectured about. Oh, you're not allowed to drive for 4 weeks. And
do you like running over school children, Terry?
Well, the last time I did, it didn't turn out very well.
Right, and it won't for you or that other person. So that's it's kind of a mundane but important topic because people have surgeries.
Yeah.
And then they want to know when they can drive or when is it safe to travel. I've got a family reunion in 2 weeks. Let's not do your surgery right before that because travel that involves sitting in a car, a plane, or a train within a certain period after surgery can put you at risk for blood clots. Blood clots can be serious. So we'll talk about driving first, and we'll talk about which parts of your body are important to drive and which surgeries we should kind of hone in on for, particular protection for you and the people around you when you have to get in a car.
See, I get the part about don't drive the car if you've given me Valium or some medication, opiates of some kind for pain. I get that. What I don't get is the part where you're not supposed to drive the car because maybe you're putting too much pressure on a brake or that. But talk about the meds.
Well,
first.
Let's do that first. So the first thing before we even start is medicines. And you would never get in a car if you had too much alcohol to drink for the same reason. You could hurt yourself or others, right? So we just commonly say, boy, that person needs to get a ride home, or someone else should be driving that person.
Right.
So if you're on pain meds or muscle relaxants or anxiety medicines or sleeper medicines or anything that makes you drowsy, let's just say, narcotics or drowsy-inducing medicines, those all would affect driving, right? So we wouldn't want to get behind a wheel. And so the bets are off for any kind of driving under that, whether it's an upper or lower extremity surgery. And we're going to talk a little bit about having surgery on your arms or elbows, and mostly hips, knees, and ankles. So let's talk about what you need to drive. Well, you need arms to steer, sometimes manual transmissions,
right?
And you also need your feet to control the brake and the pedals. And importantly, the right, you'll see, is a much more important leg than the left when we drive. So let's start with the arms. We really wouldn't want to be in a sling holding your shoulder after a rotator cuff repair and then try to drive with one arm.
It'd be tough, but you could do it.
It can be done, but it's not the greatest idea. So let's talk about most of the time, if that is the down arm and you take your sling off and that elbow's by your side, that's usually a safe position for the elbow and the shoulder. If that holds the bottom of the wheel and you can hold the upper part of the wheel, I tell people, start to practice driving. If you're off your medicines, go to a cemetery. You can't hurt anybody. Some people go to empty parking lots, but it's holiday season. Those aren't even empty, right? But go practice somewhere and see if you think you can control the wheel for upper extremity, driving after surgery. The second thing would be, are you in a brace or a cast that limits your elbow from moving? Well, that's kind of important to know because if you have to try to use a manual transmission, you're not going to be able to shift the gears or you might have to borrow somebody's car who has an automatic transmission or some other means of driving. So elbow, shoulder, and immobilization devices are kind of deal breakers for driving safely. Not a wrist splint for carpal tunnel. Those are safe. You can hold a wheel with a little wrist splint. So that's kind of the upper extremity driving recommendations. And you'd want to ask your doctor and your surgeon, like, what do you recommend? Because they may not be what I recommend.
So every doctor will have a different?
Absolutely. Yeah. I mean, every doctor is going to tell you a different anti-inflammatory he likes or she likes. They're going to tell you what they think is the best option for this problem. They're going to base it on their knowledge, their experience, and maybe just their training. So let's look at the legs. So there's a huge difference between your right and left leg having surgery on a hip, knee, or ankle. First of all, if you're in a boot or a cast, you really shouldn't be driving at all with a right leg problem because that controls the pedals.
Right. You could get
and
stuck.
You asked a little bit about putting, too much force down on a pedal. Well, actually, it's the opposite. People who have an injured leg or what's called a slow reaction time don't brake quickly enough to stop suddenly if they have to. And that's unsafe for little Billy, whose balls rolled out in the street, or for the people in your front seat or back seat that are hopefully strapped in with seatbelts. So I tell people you would want to you'd want to say, well, how much force? Let's say I'm going down the road, I'm on the highway, I'm going the speed limit, but there's all of a sudden a wreck in front of me. If you have to apply an emergency brake at 60 to 70 miles an hour, you need 85 pounds, which is like 35 to 40 kilograms for our overseas metric
We do have
people.
a lot of overseas people watching.
Well, again, it's a lot of force.
Yeah.
So 70 pounds, 70 to 80 pounds or 35 to 40 kilograms is a lot of force to slam a brake on to stop before you slam into that other car, hurt yourself, hurt them, hurt the people in the car with you.
Right.
So they look at this it's called a brake travel time or a brake reaction time, and it's how quickly do you react to apply a brake. We all like to go. Well, gosh, going's great, skiing's great, but if you don't know how to stop on skis, you're going into a tree, right? Or you're going into the chalet instead of having après ski drinks. You're having, your face stitched.
Rule of thumb, and this is where I think people will break this rule every single time because I have family members that do it. If you have a boot on, shouldn't be driving.
Well, your ankle can't move back and forth, right? It can go forward and back. Yeah. Honestly, I think that's up to you and your conversation with your healthcare provider. Now, there may be ways that you say, look, I know I can bend my knee, I can stop and start. But again, you also have certain ankle fractures that we fix, we put back together.
Right.
The recommendation for those fractures is 6 weeks before you drive, if it's a right leg. Now, again, I'd agree a left leg, probably not a problem in a boot. Because, again, if your right leg is free, we talked about right and left being different. A good rule of thumb would be the earliest you'd want to look at driving with a right leg surgery would be 2 weeks, but the safe answer is 4. And certain things with fractures and boots and cracks that go into a joint, like the knee or the ankle, might be 6 weeks.
So
for a right leg. Now, a left leg, again, if you're off narcotics, if you're off, your dizzy and drowsy medicines, much sooner. For a left leg.
So the guy driving this car, it's an automatic. No, I'm sorry, it's a manual transmission. You got the clutch.
Sure.
That's your left foot.
Well, now you need the left foot a little more.
You need the left foot. So if you're driving a clutch car, which isn't that popular these days, but you need that left foot.
Yeah, you're right. And again, you don't want to say, oh, you can operate. First of all, the distance between the pedals isn't great between a clutch and a brake.
No. Yeah.
And now you've got a boot that looks like some big ski boot from Zermatt, and you're deciding I can do it. Well, there's a bit of macho in every person that thinks they can do more than they can.
Oh yeah.
So again, that cemetery, you're not going to hurt too many people practicing there. So if you think you can handle it, the other thing is borrow your spouse's car. Let them drive yours, even though they can't.
Don't drive a clutch,
and
basically.
Yeah, get a simpler to operate vehicle. And that covers driving, I think, because driving is critical where most of our areas in the United States don't have mass transportation, where you're going to hop on a train like we do in Europe and some of the parts of Asia.
So real quick question that relates to this. Are physicians liable if I say if you tell me after a surgery, you can drive after 3 weeks? Well, somebody else would have said 6. Are you liable by saying 3 weeks?
I don't think so. I mean, I'm not a lawyer. That's apparent. But certainly, I don't think there are written in stone guidelines for this. I mean, I researched some of my podcast information, and the recommendations are kind of all over the place. Yeah. 2 weeks, 4 weeks, 6 weeks, right leg, left leg, in a boot, not a boot. And half of them don't even distinguish automatic and manual transmissions. So I think, short of being Fred Flintstone with a foot on the ground pushing the car, I think you're the main thing would be whatever you're trying to do, take it somewhere safe first, right, and see if you can do it. It's not any different than getting on one of those little scooters or razors. I mean, like, do you really want to mess up what your surgeon just did for your problem just to say, I'm doing something I shouldn't do too soon?
So basically that answers the last question I have here is, how do you know? It's basically go out and try it and use your own common sense.
And do it in a place where you're not in traffic. Do it, empty parking lot or a school. All the schools are closed in the summer in the United States.
Yeah, but people hate, you hate to burden someone. Hey, can you drive me to the store?
Good friend. Well, what does a good friend do if you've had too much to drink? Like, I hate to burden you, but I guess I'll drive myself home drunk. Right. Well, that doesn't make sense. So you should ask. Your friends are basically friends. Yeah. Yes, I'm not going to. If Uber wants to be a sponsor of this, I'll mention their name. Otherwise, maybe Lyft will.
All right.
So I think and I'm waiting on Elon's self-driving cars. That's not going to be too far away, where this conversation, as my patients call it, is mute. They say, if you have a self-driving car, like, you don't need your legs.
Right.
You just need to be able to program where you're going. And that's not that far away.
It's not.
So let's talk about other forms of planes, trains, and automobiles. So travel. So
just travel in general.
Yeah. Before you have surgery, I tell my patients, especially this time of year when summer and kids are out of school, you're going to go to a family reunion somewhere. Well, don't plan your big knee surgery a week or two before traveling. Travel beyond an hour, for longer than an hour in any direction in a car, train, or automobile, gives your leg potential problems with blood clots because it's just there. On a plane, you're not allowed out of your seat till the stand up off the seatbelt sign and get up and move around sign comes on. So, you may be stuck in a position with a
tight space.
You might be with a fat person in the seat next to you, the middle seat, crowded in. All of a sudden your leg is cramped. You get a blood clot in your leg. It can occur from various reasons. There's reasons people get blood clots. It's immobilization, meaning the leg's not moving. You're in a car or a plane or something for a long period of time. 2, you've had a previous clot problem, or your blood is a little thicker than usual. Some of the cancers, some of the blood disorders, those are things you'd want to say, I'm at a higher risk factor. Birth control pills have hormone implications with clotting.
Can you take an aspirin if you're getting on a plane?
Yeah, so that would be the other thing. Have a conversation with your doctor. Say, I'm a traveling salesman, and I have to go to London in 2 weeks after surgery. Well, Terry, I'm going to put you on a blood thinner, probably something even more effective than aspirin. But aspirin's been shown to be very effective in most cases for a lot of people who want to keep their blood thinner and not have the platelets sick. I'm not going to make recommendations on a show like this for any kind of treatment, because that is a discussion with your doctor. But don't start the proceedings of a surgery if you know you're going to travel. Just wait till you get back from your cruise. Right. Well, I paid money for my cruise. I really want to go. I'm like, well, go on your cruise, and I'll put a little shot in your knee to get you through till you get back. So delay your surgeries, go on your trip, and then try to avoid travel for it's safe, because a blood clot in the leg can drive up and travel up to your lungs and cause what's called a pulmonary embolus. You can die. So if you get short of breath, or if you get any leg swelling after surgery, or low-grade fevers and redness or things, there can be signs of a blood clot or an issue that is due to what's called stagnation of those vein blood particles, and those lead to clots. Common with travel. Yeah. So, talk to your healthcare provider about when you have surgery, and then what about afterwards? When's it safe to travel? And if I have to travel, then let's cover it with some appropriate medications so I don't get a blood clot, which you can do.
But this gets me to the question of the hour, right? You say talk to your healthcare provider, talk to your doctor. You're not sitting at your desk saying, Dr. John Urse, how can I help you today, right?
Aren't you scheduling surgery someday?
Yeah, but what
this
if
is
what
this
if I'm
is
after
travel
the
after
surgery
surgery.
and I'm going, I need to talk to you. That's not an easy thing.
You need to have, and write this word down. It's called a key, and the second word is contact. So the key contact is your doctor's medical assistant or physician assistant or provider that you know who can I get a hold of with questions. So when you have a procedure, like I don't want doctors' phone numbers. When they say, here's my phone number, I don't want it. They don't answer their phones. You can't reach them.
Exactly.
I want their medical assistant who knows where they are. Your wife's calling and said it's their anniversary, you better bring her flowers. Like, that assistant will get a hold of the doctor, okay? Trust me, there's a way every doctor gets reached, and that's the person you want. Now, you may not get that number. They may give you the generic office number, and then you're in a scroll and you're miserable. There are online questioning things, but only if they check it, right? If you're not opening your mailbox, you're not getting your letters. So, email. Some of the online things. We have things called MyChart. We have, various offices have communication methods. You want to set that up ahead of time. You don't want to go to Oktoberfest in Munich, say, wow, what a great day we had. We got over here. The flight was good. The food was great. The beer was wonderful. I forgot to get a hotel.
Right.
Like, well, that's kind of dumb. So plan things. Don't say, well, I don't know how to get a hold of my doctor that just, reconstructed my knee. Like, well, that's your fault. Now you're going to go to an emergency room. You're going to get somebody on call who's going to do their best and hopefully get access to your records. But you always have the option, if there's a problem, to go to a medical facility and have somebody check it. But you really want to do that ahead. Doctors are always in a hurry, just like everybody else.
Yeah.
So take a few questions when you plan a surgery and say, look, I've had all these stupid shots and therapy. I need surgery to fix this. I'm tired of, delaying it. Well, at that point, you should say, how long will I be off work? What kind of work can I do sooner?
Right.
When can I travel? Who can I call if I have a problem? And what if I need an extra refill on my medicine? Well, how do I, every office has some form of that. Now, a lot of it's online. Some of it is in a brochure they give you.
Right.
Call this number.
I hate that generic number you call, press 2 for this.
Yeah.
And it's just a death
Yeah,
spiral.
1% of your adult life is spent on hold.
How much?
I made that up.
I was going to say, how the hell did you have that stat in your head?
I don't, but I mean, every now and then. It's a podcast, so there's no rules.
That's right. Anything else we want to cover before we land this one?
Well, I got to leave you a Jerry Seinfeld quote.
Please do.
Okay, so we talked about not getting a blood clot by not being in a car too soon after a big surgery and having your leg in one position where it doesn't move. So Jerry always says, living is good and dying's not so good.
That's the quote?
That's a quote. Isn't that simple enough
by the way,
to say, I don't want to run somebody over because I can't operate the vehicle correctly.
Yeah.
Or in my own car, I don't want to hurt them. Or in the selfish department, like, why do I want to get on a plane going to Seattle from the East Coast in the United States for 5 hours and getting a blood clot in my leg that could kill me? Like, not too smart. So living is good.
Living is good. So just so you know, Jerry Seinfeld is a big Porsche fan.
He's a big car fan.
So
I'll have Jerry on the show.
We'll have him
at
on the
some
show.
point.
Sure.
It might not be that easy, but he did do a thing on driving in cars and getting coffee with
Cars with coffee.
Yeah, so we'll see. Jerry's not doing his show anymore. It would be a little boost to the ratings probably for the Bone and Joint Playbook. I'll check out.
Especially
if he went to
Zurich,
Toledo,
Germany.
If he went to Toledo, he'll come to Dayton.
Yeah, I don't know. Toledo's got a lot going for it. It's got water.
Well, it also had a big venue he needed, and they book the tours in places that they can stay geographically near each other, and they move on like the music tours. You're a big music guy.
I'm sure we just lost 90%
so
of our audience.
Wouldn't there
right
be
there.
one thing you want to say about this that is a Beatles quote on whether, baby?
Baby, can I drive my car? I forgot to use that quote at the beginning.
I'm teeing you up for that.
Well, I blew it.
Well, let's thank our sponsors real quick. We want to thank GWR Financial, their advisors, Guy, Brad, and Jeff Richardson. Our website, their website will be available for you to see. Also, Ted's Salad Dressing. Ted's Greek Dressing is a dairy-free, gluten-free, sugar-free marinade and dressing. You can get it online at tedsaladressing.com or at some of the local Dots markets in Dayton. But we're hoping it'll be more global in the future.
Because it's good. It's good. Trust me, it's great stuff.
And all you Lyft company executives or Uber, if you'd like to sponsor for this
Hey, that's
podcast,
a great idea.
feel free to call us.
Yeah,
and
okay.
we'll plug you more than, some of these people that can't drive the other cars.
All right, guys, thank you very much for joining us. It's been Dr. John Urse for the Bone and Joint Playbook, 7-minute drill, which we went over 7, but that's okay.
We always do.
See you guys.